And the insurance company is way too interested in what's happening between the doctor and the patient. You know, to the point that they become like little peeping Toms peering into this very intimate moment in our lives. They want to know if the doctor's prescribing too much or too few medications, if he's spending enough time with the patient or too much time. Is he educating the patient about wellness and non-smoking and all this kind of thing? Why is that the business of the insurance company? Why is the insurance company involved in this relationship at all? This is between me and my doctor. and if it's a service that the two of us agree is needed, then the insurance company's job is to pay for it or not pay for it, as the case may be. Very often they don't, but we should know exactly what they're going to pay for ahead of time and not afterwards. Okay. So consumer-driven healthcare is designed to take money out of the hands of the insurance company and put them in our pockets, so that we can make more of our own decisions and pay our own bills instead of relying on third-party payment to do it all for us. It began really in 1996, at least as far as Congress is concerned, when they enacted medical savings accounts. Now, MSAs were designed as a demonstration project. They were available only to individuals and small groups. There were drastic limitations on the time of the demonstration project and the number of people that could be enrolled. They were confusing and complicated, and very few people actually bought them, and frankly, very few insurance companies offered them. So they did not do very well in the marketplace. And also, at the time, most people, certainly most employers, were thinking in terms of managed care. They saw managed care as the future of healthcare. So this seemed to be a distraction. Now, in the late 90s, as managed care collapsed, employers began to think, what else can we do? Managed care isn't working. And they started looking at the example of medical savings accounts. So medical savings accounts were a market failure, I think, but an intellectual triumph, because they laid out for the employer community a different way of providing benefits. And this resulted in around 2000, 2001, more and more employers started looking at the current tax code for ways that they could replicate the experience of a medical savings account. And they came up with what the IRS later called a health reimbursement arrangement. And in 2002, the IRS laid out the guidelines that employers should follow if they want to do what they called a health reimbursement arrangement. Now, HRAs are very attractive on a lot of levels. It is all employer money. It can go with any insurance plan or none at all. It's simply setting up an account that is available to the employee to tap into to pay for health care services. The money is never owned by the employee, and when they leave the job, it's forfeited. But given those constraints, it works very much like a medical savings account. That became pretty popular with HR managers and large employers. And a lot of new vendors came along helping them set these programs up. And it was that kind of intellectual support, that buy-in, that I think led to the enactment of health savings accounts in 2004. Now, health savings accounts were a real breakthrough. They are available to anybody except those on Medicare. The money in the health savings account is owned by the individual. It's completely portable. Even if the employer pays that money, the employee owns it, and the employer can never take it back. You can change account holders. There are restrictions. You need a certain level of deductible, not too high, not too low, but as long as your underlying coverage meets that, you can put a lot of money into your health savings account on a tax-free basis. You can fund it, your employer can fund it, Aunt Matilda can fund your HSA if she would like to. And that is extremely attractive, and we're seeing very good results. And then finally, in 2007, Medicare MSAs were enabled, and they're not exactly taking the country by storm, but they're out there and they're very attractive. I know a number of people that have them, and I expect them to grow with time. Now, we made some predictions back in 2002 about what consumer-driven healthcare would do, and I apologize for this slide, lots and lots of words. Will these presentations be on the website eventually? Okay. So don't feel like you have to really study it. There will not be a quiz at the end of this. But we predicted that consumer-driven health plans would increase consumers' cost awareness. That increased cost awareness would lead to more caution in their consumption of healthcare services, which would lead to growing demand for information because once they were empowered, they wanted to know how best to spend their money. Once they had that information in hand, they would begin to comply better with their treatment programs. They would understand what had been prescribed, what had been recommended. They would be invested in their own treatment program, which would lead to lower use of unnecessary care, which would lead to a lowering of the rate of increase in healthcare costs, which would lead to faster take-up of the programs in the marketplace, which would finally lead, so far very little has been talked about health services delivery. It's been all financing. But all this financing stuff is ultimately about getting healthcare services. All this stuff, I contend, will ultimately lead to a revolution in the delivery of healthcare services. It'll become more accountable, more efficient, more convenient, and of better quality than what we've seen in the past. And that's ultimately the point. It's not just moving the money around. It's to get a better healthcare system for all Americans. Now, there was an intense debate over this. I mean, there are a lot of critics that didn't and still don't like this idea at all. They argued that health savings accounts are only good for the healthy and wealthy. And in fact, we could talk about this more during the Q&A session, but actually it's been demonstrated in some studies in Health Affairs, the Health Policy Journal, that actually HSAs are very good for the healthy and the sick. Both groups do better financially with it because their out-of-pocket exposure is limited, unlike, by the way, Medicare, which is very popular. But did you know that Medicare only pays about half of the healthcare expenses of the elderly, and there is no limit whatsoever on out-of-pocket spending for people on Medicare? It can go on forever. And then saving money actually is of greater benefit to low-income people than it is to high-income people. I mean, if you can reduce your insurance premiums from $6,000 a year to $4,000 a year and save $2,000, that's a lot of money to someone making $20,000 a year. It's chicken feed to someone making $200,000 a year, and so actually this is very attractive to low-income people and to non-healthy people.